Where actually does dementia start? If you guessed liver, then you're onto something big, because your assumption might be the right answer. In this video, we'll discuss what experts and the latest research have to say about the close connection between the liver and the brain, which can shockingly affect each other's function. Did you know that our understanding of dementia might be completely wrong? For decades, scientists believed Alzheimer's and other forms of dementia originated in the brain. But new research suggests a surprising alternative, which is the liver. Dr.Berg, a respected ketogenic expert, also proposes that dementia might actually start in the liver, not the brain. This unexpected theory is causing quite a stir in the medical community and could change how we approach brain health.
Now, we all think that Alzheimer's is a brain problem that starts in the brain, right? It starts in the brain and then it develops in the brain and it's not connected to any other part. But I found some real interesting data that shows that Alzheimer's actually originates in your liver. The liver has a function of clearing out something called amyloid B plaques. And so the liver should normally clear this out so it doesn't spread into other parts of your body. But when the liver is compromised and it can't do that, whether you have a fatty liver, you have cirrhosis, you have inflammation, you have diabetes, you have metabolic syndrome, whatever, then the liver is going to have a very, very hard time getting rid of that plaquing. And then it starts developing in the brain, but you won't have symptoms for roughly about 20 years. Then you start getting the dementia.
So, could liver health influence a person's dementia risk? Keep watching to learn why your liver health might be crucial for maintaining a sharp mind as you age. The key to understanding this unexpected connection lies in the liver's role in clearing amyloid beta plaques from the body. For those who don't know, amyloid plaques are some sticky clumps of protein that accumulates in the brain. So when some liver functions are compromised, removing these plaques efficiently becomes a real struggle, potentially leading to their accumulation in the brain over time. What's particularly concerning, as Dr. Berg mentioned, is that symptoms may not manifest for roughly 20 years after liver dysfunction begins. This long delay between cause and effect could explain why traditional brain-focused research hasn't yielded the breakthroughs we've hoped for. The liver's role in amyloid plaque clearance could be a critical piece of the dementia puzzle we've been missing. By maintaining good liver health, we might be able to prevent or slow down the accumulation of these plaques in the brain, potentially reducing the risk of cognitive decline. But how exactly does the liver influence brain health? And what other connections might exist between these two vital organs? To answer these questions and understand the full implications of Dr. Berg's theory, we need to take a closer look at the complex relationship between the liver and the brain. The brain is the most negatively impacted organ when the liver fails to perform its two primary functions of regulating metabolism and detoxification. Through the loss of these essential functions, liver disease can lead to cognitive impairment and promote brain changes associated with increased dementia risk. A study published in July 2023 found that individuals with liver scarring showed lower cognitive abilities and reduced brain structure in several brain regions, including the hippocampus, thalamus, and cerebellum. This discovery highlights the far-reaching effects of liver health on our brain function. As we dig deeper into this connection, one factor keeps coming up, which is inflammation. Inflammation appears to be a crucial factor in cognitive decline. The theory about swelling and aging, also known as the oxy-inflammation hypothesis, proposes that immune system problems and aging contribute to Alzheimer's disease, and liver dysfunction can directly make these issues worse. By focusing on reducing inflammation through liver health, we might have a new avenue for preventing cognitive decline. So, how can we use this knowledge to protect our brains and maintain sharp cognitive function as we age? Let's further explore the practical implications of this new understanding. Let's find out. If you are not already a subscriber of my channel, please go ahead and subscribe to my channel and share this video to whom might benefit best. Apart from consuming specific nutrients like bile salts and vitamin D, and practicing intermittent fasting, diet plays a crucial role in maintaining liver function. Here are some foods that support liver health. 1. Coffee. Coffee has anti-inflammatory and antioxidant benefits. Studies have shown it can lower the risk of liver disease. Researchers say coffee is a plant food, therefore it has the health benefits of substances called polyphenol. 2. Blueberries. Blueberries contain insoluble fiber and antioxidants. One study found that fruit fiber, in particular, contributed to the increase in liver health markers. 3. Grapes. Grapes contain insoluble fiber and antioxidants. Antioxidants are important because oxidative stress has been associated with liver damage. A randomized study found that a combination of diet and antioxidant supplementation had the greatest effect on health. For beetroot, beets have the same effect as grapes. They contain a class of antioxidants called anthocyanins, which reduce inflammation and improve blood flow. 5. Nuts. Nuts, particularly walnuts, are rich in polyunsaturated fatty acids and have been shown to support homeostasis in the metabolic pathway. This means they can help prevent the liver from absorbing too much or too little fat. 6. Fatty fish. Fatty fish contains primarily omega-3 fatty acids, which have long been shown to have anti-inflammatory effects. A review of recent studies has shown that omega-3s and PUFAs have a significant benefit on metabolic risk factors, liver fat content, and liver enzymes. 7. Olive oil. Olive oil is a monounsaturated fatty acid. This type of fat is beneficial for cardiovascular health and can also benefit liver health because of its anti-inflammatory properties. 8. Oatmeal. Oatmeal contains soluble fiber and can help with cholesterol reduction. Additionally, diets high in fiber may help lower the risk of liver cancer. 9. Garlic. Garlic is a prebiotic, which is a substance that feeds the probiotics in your gut. Several recent studies in both humans and animals have shown an interesting connection between the prevalence of NAFLD and gut bacteria. This underscores how important your gut is to your health. Additionally, diets that are high in processed foods and sugars can increase the risk of Alzheimer's disease by promoting brain inflammation and the buildup of harmful proteins. To protect your liver and brain, it's essential to focus on whole, nutrient-dense foods that support overall health. The idea that treating liver disease could prevent Alzheimer's is causing heated debates in medical circles. This concept challenges decades of established thinking about cognitive decline, turning traditional neuroscience on its head. It's a radical shift that brings with it a host of challenges and controversies. One of the biggest hurdles is the deeply ingrained belief that dementia is solely a brain disease. Medical beliefs, especially those as established as the brain-centric view of dementia, are notoriously difficult to shift. It involves reshaping entire educational systems, research priorities, and treatment approaches. The ethical implications of promoting liver-focused treatments for dementia are significant. There's a concern about diverting resources from brain research to liver studies, potentially giving false hope to millions of people affected by dementia. Critics worry that this new theory might oversimplify a complex disease known to involve multiple factors, from genetics to lifestyle choices. As we conclude, it's clear that liver health plays a more crucial role in brain function than previously thought. While more research is needed, there's no downside to giving your liver some extra attention. Why not start today? Your future self might thank you for it. Remember, taking care of your liver could be a key step in safeguarding your cognitive well-being.